Welcome back everyone to Showbiz India, and right now it's indeed my pleasure to once again welcome Dr. Yeral Patel, who's our health and beauty expert, and today we're going to talk about hair loss. Now that's one of the things that's most researched on the internet. I get asked about it all the time. Do you get asked about it a lot?
I get asked about it all the time, and especially it starts very early too. We see people asking questions as early as 16 and then up to 20s, 30s and onward.
So what are some of the causes? Do hormones make a difference?
They absolutely play a role. And if anything, I always tell patients that's the first thing you should work up before you try anything else, because once you take care of the underlying cause of the hormone problem, the hair growth gets back all naturally by itself.
What does one do to get their hormones aligned?
So the first thing you would do is you'd go to your family practice doctor, do a basic panel, check the thyroid, test estrogen and progesterone and all the other, like a normal blood count to make sure you don't have anemia or anything like that. And then after that, your doctor will tell you if you have any deficiency and things that you can do to kind of get those hormones back to normal.
And what about diet and exercise?
So that is probably one of the most important things. I cannot stress enough. Diet number one is for hair to grow, it has to have good nutrients and the hair follicles. And so you want to have like a lot of antioxidants, like the berries we talked about. You also want to make sure you're not eating a lot of processed foods, because processed foods and toxins, they all make the hair follicle kind of dissolve, and it dysregulates your hormones again. So it kind of disrupts that.
And what about exercise?
So exercise is always important. Again, it's going to help in the process of detoxing all the toxins out of your body, hormone regulation, and just getting everything back together like that.
And so what are some of the natural therapies? Because I know you're really into natural solutions.
So usually the first thing that I'll tell my patients is to pick up some supplements. With the supplements, I always tell all my patients to make sure they disclose it to their doctor, because some have side effects, and if you're pregnant or breastfeeding or something like that, you don't usually want to touch them. But my favorite one I would have to say is basically Biotin. Biotin you can buy in a capsule or dissolvable tab. Biotin is a structure that actually helps fortify and strengthen the hair. So that's a must. Other things are like B complex vitamins, because that has biotin. All the B vitamins help the follicles grow and help it like with the shininess of your hair.
Now also I've been hearing about PRP, which you are an expert at. PRP is also being used for hair growth?
Absolutely, and I'm glad you brought that up, because that's something that a lot of people are not aware of. Instead of going straight to the hair transplant, which is a little bit more invasive and also costly, we can do something like PRP, which is very simple, minimal downtime, and it really helps stimulate the hair follicle. You actually see more hair growth and hair getting more and more thicker.
Can you walk me through the process?
PRP for hair is very similar to the PRP for the face. We're going to take your blood, we're going to spin it, and the nice thing is when the platelets come out for the hair, there's a specific growth factor called keratin growth factor, and that one enhances hair growth, so it's really nice. And the nice thing is it's specific to only the scalp, so you're not going to grow a lot of hair on your face with PRP, but from the scalp it actually stimulates hair growth. We pretty much microneedle it and then we put the serum back in there.
And is that painful?
It is a little bit more painful than the face, but we numb you. So it might feel like little tiny sandpaper rubbing against your head. So usually it's not that painful at all.
And how effective is that?
It's a little slower than your PRP for your face. This one, you want to do 3 treatments in a 1 to 2 month sessions apart. And then you'll see hair growth a little bit slower. So you'll see hair growth and thickness within 6 months to 12 months. So it does take a little bit longer. You have to be a little bit more patient, but we always add other modalities like hair oils and other treatments on top of that, because multiple different types of treatments help with hair growth.
Oh yeah, that's fantastic. And age-old oil is great for your hair because it stimulates your hair follicles. What is your opinion?
I completely agree with you. People have been doing it for years, especially with Ayurveda and things like that. The most important thing about the hair oils is that there's a couple of things that happen that slow down hair growth. One is dandruff and dry scalp. So hair oils like lavender, like the olive oils, the coconut oils, the jojoba oils, they're all going to help kind of take away that dandruff, so then that follicle has room to breathe. So that's one of the main things that does help with oils.
Thank you so much again, Dr. Patel. That was some great information. And remember, you can get in touch with Dr. Patel with all her social media and information that's on your screen. And of course, you can visit her at Newport Beach. Thanks again, and we'll see you next time.
Thank you. It's a pleasure to be here as always.